Good afternoon, July 22nd, 2025. I'm Dr. Duke Majan. Our patient presents here from Virginia. He's had back pain for many years. We've already done a Duke laser disc repair at L5-S1. He's back for another Duke laser disc repair at L4-5, the level above. He was doing fantastic. No pain in his back until a few weeks ago. He felt a pop. We thought maybe he re-herniated his disc at L5-S1, but nope. That disc is still gone. And the herniation is gone. There's no re-herniation. It looks amazing. Shot. So instead, he has a herniation at L4-5. And we're going to go take care of that. It's very mild, very small bulge, but it is visible on the T2 sagittal images shot. And by the way, L4-5 is the most common disc to cause back pain. All right, Henry, while we are getting access to his disc through a transforaminal approach, this is for endoscopic spine surgery. Can you move your fluoro this way so I can manipulate my hand? Shot?
Yes.
What's the issue, guys? All right. Are you going to show us the 30 causes of back pain?
Of course.
I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic sciatic pain down their legs with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. All right, welcome back. You've seen from our video shot that there are about 30 specific things that cause back pain, specific structures. Discs, 5, facets, 10, SI joint, 2, piriformis muscles, 2, and tumors, fractures, infections. If you add them all up, there's exactly 30 causes of back pain. Now, this patient has already had one treated, his disc, plus facet. We're back now because he has more disc pain, but this time it's coming from the disc above the one we treated. And that is the L4-5 disc. So we just tested the disc to see if it was causing his back pain, and it is. He said it was a 10 out of 10 pain, concordant, meaning that's where he gets his back pain from. You ready? Where's my pedal? Yeah, somebody's got to put it where I can reach it. Thank you. All right. If you have questions, feel free to ask. In the meantime, Henry, show the audience how it is that these disc herniations can be so painful for patients.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our video, disc injuries such as a herniated disc, bulging disc, ruptured disc, protruded disc, disc bulge, disc extrusion, slip disc, degenerated disc, spondylosis, all of those disc problems, they're all the same. There's really no difference between them, just degrees of degeneration or size of herniation. Anyway, long story short, they all cause pain in exactly the same way. It's basically a tear in the disc. Now his problem is a small herniation. It's called a bulge, B-U-L-G-E, bulge, disc bulge. The most common cause of back pain is a disc bulge, AKA a small disc herniation, and that's what he has. Now when I fixed his back originally, he had a gigantic herniation at L5-S1. L4-5 wasn't too bad at all. And all of his pain was coming down at L5-S1 at that level. So we diagnosed him with an L5-S1 herniation and facet pain. We did a Duke laser disc repair L5-S1. And guess what? That herniation's completely gone. and he was doing 100%, no pain, for several months. And then suddenly he did something and he felt a pop in his back, and he contacted me because the pain was severe. We got a new MRI scan expecting to see he reherniated, but we did not see a reherniation. Instead, we found a new herniation above where we operated. This new herniation was L4-5. And he even said to me, my pain feels higher in my back, higher up than it used to be. So people know their back pain pretty well. He's no exception. They talked about it, whether they wanted to get it fixed or not, and they decided yes. Why? I'll tell you why. Because he had tremendous success with his first surgery. That's why they decided to come back and get another surgery at the next disc. Now let's hope we can keep this disc from degenerating. Any questions?
Yes, we have a question coming from, forgive me if I mispronounce this name, Sam Yak on YouTube,
Samyak.
asking what causes shifting pain of sciatica?
What causes shifting pain of sciatica? First of all, I've never heard the term shifting pain of sciatica, but I'll assume that this person is saying, why does sciatic pain get worse at times, better at times? Why does it seem to go down my leg sometimes and not all the way down others? The answer is the sciatic nerve is a bunch of nerves that go to different places in your leg. So if one part of the nerve is affected one day, then you're going to have pain in one distribution, and it can be different than pain another day. So it's either that you have multiple herniations affecting the different nerves that are making up the sciatic nerve, or it just fluctuates with the amount of inflammation you're having. In the end, it doesn't matter. You want to get rid of that pain, you're going to have surgery. The best surgery in the world for your problem, if it's coming from a disc problem, is the one you're watching right now, the Duke laser disc repair. Henry, let's show our audience how this surgery can cure back and leg pain coming from a disc problem.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. We have been pulling out pieces of herniation now for the last 5 minutes. We are using our laser. That's the laser ahead of you. The glass fiber is 1 millimeter thick. That's how wide it is, diameter. And we're using this laser to clean up the tear that is at L4-5 on the left side. So we confirm that this is indeed the cause of his back pain by doing an evocative discogram during surgery. And he told us it's a 10 out of 10 pain, which is the worst pain of your life. When I tested the disc, he said it's the worst pain he's ever had. 10 out of 10. And I asked him, is that where you get your pain typically in your back? And he said yes. So basically, not only is this disc causing back pain, but it's causing the pain that he gets every day. Now this white stuff, a lot of it is scar tissue. Some of it is annulus fibrosis. You can see the inflammation right there. I know we have some questions.
Yes, we
But
do.
before we get to them, I just want to share with our audience that we now have a podcast It's called the Duke Spine Institute podcast. Henry has already produced the first introductory podcast, and should be going out tomorrow, right, Henry?
Yep. Should be getting everything going by tomorrow and upload. And
Why don't you tell the audience about our podcast?
so we are launching a new podcast called the Duke Spine Institute Podcast, and this is, or the purpose of it is to reach out to people on the new cures of back and neck pain, as well as exposing the corruption and the insides of the medical industry. And we want to get that from perspectives of not only from Dr. Duke, but also patients, nurses, doctors, anybody who wants to help us participate and go forward with this. And we're just really excited. And yeah, first episode should be uploaded by tomorrow.
So look for our podcast launching tomorrow, Wednesday, June 23rd. And our first episode is already available on the podcast tomorrow. So you'll get the intro and the first episode. And then we're just going to start filling up the podcast with a lot of really neat content that you won't find anywhere else in the world. It's unique to Duke Spine and our perspective on things. We are going to talk about healthcare, access to healthcare, types of healthcare issues that matter to people, that matter to you out there, the people who are suffering in pain or know somebody who's in pain. And we're going to talk about how we can help those people get better. But there's all kinds of things happening in healthcare. For example, just today, the United States Federal Court determined that Blue Cross Blue Shield has violated the Antitrust Act and has committed egregious acts of denying payment to providers around the United States, probably around the world. And the government has the court system has basically fined Blue Cross Blue Shield $2.9 billion. And that's a lot of money, okay? That money, the government has said Blue Cross is going to have to go and pay all the doctors and hospitals that it screwed over by not paying bills. So we were one of those. We've been underpaid by Blue Cross and not paid at all by Blue Cross for years. Sometimes we would do a complex spine fusion surgery for $300,000. Come on, Luis, I need you to keep this from dripping on me. And we would get paid $3,000 from Blue Cross for a $300,000 surgery. So they're one of the worst insurance companies at underpaying providers for medical treatment that is necessary for the patients. Long story short, we're going to cover topics like Blue Cross Blue Shield, the lawsuit, and their decision by the federal court to punish them with a $2.9 billion fine. Also, we're going to talk about things like AI and how it affects healthcare, and robots and how it affects spine surgery and spine surgery outcomes. We're going to talk about the politics of healthcare. We're going to talk about the corruption in healthcare, how the implant companies are stealing billions of dollars out of our healthcare system. Also, how insurance companies are stealing trillions of dollars a year out of our healthcare system, not paying for the medical care that Americans need access to. We'll talk about the VA system and its downsides and what's wrong and why vets are not getting the care that they need. So there's a lot of topics to cover. We're going to be discussing them on our Duke Spine podcast channel. All right, any questions? We're just about done here. We've shown quite a few videos. There's some inflammation right there.
Yes.
Henry, what questions can I answer?
We have about 3 questions, and this first one is a comment coming from Mindy on Facebook.
Hi, Mindy.
Saying, hi, Dr. Duke and team. So excited to catch a live surgery. I'm 4 weeks post-op from cervical spine. Feeling great. Thank you so much.
Mindy, thank you for sharing with the world. I'm glad you're doing well, and thanks for being here to share with us.
This next question is coming from Faisal on Facebook.
Oh my God, Faisal.
asking, Doctor, hope you are well. Are you primary relying on the patient to tell you where the pain is coming from, or with scans like an MRI? How sure can you rely on someone telling you accurate information? Because it may be referred pain. Thank you.
Faisal, you are 100% correct. I rely on the patients to tell me where the pain is coming from. That is the magic of what we do. After all, if you want to fix people's pain, you've got to have them tell you where it's coming from. Scans will never tell a doctor where a patient's pain is coming from, ever. So the key is ask the patient where their pain is coming from. But thank you for pointing that out. That is a very good thing. Look at all this herniation stuck in the tear. I've got about 2 minutes left on this herniation, and then we're going to go and fix his facet joint.
Next question from Raul on YouTube. Asking, Sir, I am a great admirer of yours. I would like to know whether exercises can help alleviate pain caused by cervical nerve compression, similar to chiropractic treatment.
Yeah. Well, first of all, thank you for your kind and generous comments. I appreciate it. Exercise does not get rid of pain, but exercise is valuable for patients in pain because it helps maintain muscle tone and keeps the muscles from atrophying from disuse. Otherwise, the muscles will certainly atrophy very quickly. I don't feel any more herniations here. I feel like we got it all. So we're done. We're going to go on to fix his facet joint. But exercise will not cure neck pain, ever. Neck pain, chronic neck pain, comes from either the facet joints or the disc, or both. And in most patients, it's both. So just like earlier today, our patient with neck pain, young man from Sarasota, Florida, we had to do both facet treatment and we had to do the disc treatment. We had to fix both. So he's doing great. He's actually leaving right now the surgery center, and he's so happy with his results. So exercise, which helps muscles, will not cure neck pain that comes from a disc problem or a facet problem. You must have the disc treated and the facet treated, okay? All right, we're going to keep going. I'm going to staple this closed, and then we're going to fix the facet joints on this left side. Any other questions?
Yes, this next question is coming from Lanu on YouTube.
Hi, Lanu. Welcome. Come on in.
Asking, what is your view about stem cell research?
Well, thank you, Lanu. Stem cells, for all of you, stem cells are a natural type of cell found in the human body. We all have stem cells. We're born with them. As a matter of fact, we're born with stem cells, but we also have them in utero as a developing fetus. So when your mother and father come together to make a baby, I need that magnified. You need to zoom in more. When your mother and father come together to make a baby, the sperm and the egg come together. The sperm injects its nuclear material, DNA, into the egg, and then they combine and form a zygote, and then that basically divides into a multicellular organism, the multicellular organism. And so as you continue to develop into a fetus, you have these stem cells that are basically starting out as what are called totipotent stem cells. Toti means all. So your early stem cells can become any tissue in your body, any tissue, like muscle, brain, liver, kidney, intestine, bone cells. So early stem cells can become anything, okay? And later on, as they start to differentiate into specific types of cells for specific tissues, they become what are called, instead of totipotent, multipotent stem cells, and then eventually they become highly differentiated cells. I need you to go a little north. I'm trying to get one extra facet up there because I think I need you to move north a little bit because he's having pain a little higher. So I think it's higher. I want to make sure we get everything. All right, let's show the audience how we treat facet joint pain. All right, can you do that, Henry?
Of course.
For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. I've just been trying to target the right spot to destroy the pain nerve here, and finally got the proper location. The first step here is for me to place my probe on exactly the right spot to treat. That exactly the right spot. Did you watch the video? Do we show them the video?
On how it is, what causes facet joint back pain?
How we
Yes.
treat it.
Not
how
yet.
We treat it. All right. Let's show them how we treat it, which shows you exactly how we target pain nerves to the facet joints to eliminate them.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. We've just completed the Duke laser disc repair and the Duke plasma rhizotomy for this patient who has both disc pain and facet pain on the left side. His pain happened suddenly as he was getting, I think, moving his body in a certain way into a car or something. And he had a sudden onset of sharp pain at L4-5. He knew right away that that pain wasn't the same as his prior pain at L5-S1. And he told me, I think it's higher up. And I looked carefully on the MRI, and sure enough, he had a tear in the posterior annulus at L4-5 with a small bulge and herniation. It didn't look bad on the MRI, but I knew it had to be coming from that disc. When we just went in right now and did the endoscope, I could see that there was a tear. I could see the herniation. I could see the inflammation. So we confirmed it through our evocative discogram, plus visually I confirmed it by seeing the tear and herniation at 4-5 on the left. We also did his facets on the left side at 4-5 and 3-4. Because I think he had facet pain at L3-4 as well, I added it in. That said, we lost about 2 mils of blood, and we're done. Any questions for me?
Yes, we have a comment and a question. This comment's coming from Warren on YouTube saying, Dr. Duke, this is Warren.
Hi, Warren.
I am feeling great. Thank you so much. You are the Michael Jordan of back surgeries, and your staff and facility are amazing. Thank you so much.
Well, you know, this is the best that I've ever had. I've been live streaming for 11 years from this operating room right here at Duke Spine Institute, all of our surgeries. And for the last 2 weeks, we've had so much support from our past patients calling or texting in, watching, and sharing their success stories with their treatments they had at Duke Spine Institute. I've heard more testimonial from our past patients in the last 3 weeks, 2 to 3 weeks, than I have like in the last 11 years. So I just want to say it means a lot to all of us because everybody in the operating room hears you. Thank you so much for sharing your experience with everybody out there.
And then lastly, coming from Faisal once more on Facebook, asking, Doctor, would you advise anyone with back/neck pain to avoid chiropractic manipulations? They crack the facet joints right?
Yeah, Faisal is asking, would I recommend people to avoid chiropractors? No, I don't. I think if a chiropractor can do a treatment on you and get you feeling a lot better, you should do it. The only time you want to avoid a chiropractor manipulation is if you have a herniation that's pinching your spinal cord and you don't want them to make that worse by cracking your neck and squeezing out more herniation that can make you paralyzed. But other than that, if you feel better after the chiropractor, which a lot of people do, you should do a chiropractor. I support it. Have a great day. We might be back for one more surgery, a piriformis release. Thank you.